Okay, now what we're going to do is take a look at the long sit test. And the long sit test is also performed in supine, face up. And our long sit test is supposed to kind of give us some indication, is there some sacral-iliac or lumbar-sacral-iliac component or problem or dysfunction. And so the test is designed to to be done in supine. The person, they start out in full supine, then they come to a long sit test, and we're going to take a look at the position of the myelin. But again, people recommend that you set the pelvis, that you try to just get everything contracted, then everything relaxed, so it's somewhat balanced, and then you can see what's going on. So let's do that. Let's have our patient bring his knees up. We'll have our patient lift his buttocks to a bridge. Hold that bridge. Don't let me push your legs apart. Don't let me force them apart. Fight me, fight me, fight me. Now we're just going to gently relax. Don't let me push your knees together. Fight me, fight me, fight me. Gently relax and lower your buttocks down. That's it. Then I'm going to bring his legs out. It's also recommended to do a little bit of distraction manually by the tester. And as you distract a little bit, you are putting your thumbs under the inferior shelf of the medial malleoli, and we'll do a close-up of that. And we will have, then you look down, and what you're looking for is there an asymmetry. So I do see an asymmetry. I see that this person's right leg is shorter than the left, so the left leg is longer. Okay, so the next part of the test is to have the patient or the subject sit up in a long sit. So if you can sit up for me, okay, and I do a little distraction. I'm watching the movement and the position and the end position of the myelin, and what I see is that the right is still shorter and the left is longer, and there didn't seem to be any apparent change. So this person is demonstrating a negative long sit test. Okay, so let's take a closer look at what I'm talking about regarding the long sit test and where I'm palpating and what we're trying to see. And when we look at our subject in supine, I have my thumbs up against the inferior shelf of bilateral medial malleoli, and I can see, and I don't know if you can see the same, is that the right, which is this side, is slightly shorter than the left, so the left is longer. So what we're going to have our patient do is come onto a sitting position. Okay, and the legs will lengthen, but we still have it in our screen. And I see no change in the position, that the right remains shorter and the left remains longer. So essentially this individual has a negative long sit test, which is telling us that his pelvic or his SI, his lumbar-sacral alignment is not malaligned or not dysfunctional.